Ms. Rawlings, thank you so much for doing a testimonial for Chicago Arthritis. If I may please start with your age.
I am 54.
Okay, thank you for that. And if I may ask you just a few questions in regards to the testimonials, just because patients do like to hear the outcome of every procedure for the patients that we take care of at Chicago Arthritis. If I may start, please, what was your life before having the procedure that you weren't unable to do?
Oh, gosh. Just day-to-day walking was hard. I'm a triathlete and I work out pretty much every single day. So that means I'm swimming, I'm biking, and I'm running, and I'm doing long distance. And it was almost a year ago, I couldn't even run anymore. It was to the point that even just doing stairs, going up and down was beyond painful, that I was grasping the railing just to get up and down to help myself. Biking was completely out of the question. Swimming was out of the question. And just working out with body weights were out of the question. It was horrible before I had this procedure done.
Wow. If I may also ask, can you let me know a little bit about how was the procedure from the start to your end of the procedure?
Actually, the whole procedure was quite easy. I thought it would be a lot more complicated than what it was. It is kind of stunning the first time if you've never had a shot in your knee before.
Yeah, that's true.
It's kind of, it's surprising, but it's nothing that I'm one with a low pain threshold, so any kind of pain, I'm baby about it. But this was very easy. When they do the actual extraction of the bone marrow, it's a little more intense, I will say that. But that was, out of all 3 days, that was the only bad part. In the afternoon when they did the injection, of course, you're out and you're not realizing what's going on. But just that one morning, other than that, the whole procedure is actually quite simple. I thought it was, on a pain scale, I would put it at a 3 or a 4, and I'm a big baby.
No, but thank you for that. That's very good information, because a lot of patients do ask us that information. And it's good to hear from an actual patient that experienced from start to end of the procedure. So that's very good of scaling. And thank you for that, because we always ask.
Oh, you're welcome.
Give us that. And then when were you able to return back to your activities as for like work and doing your normal day after day from after the procedure that you can tell us?
After the first day, I went back to work the next day. It was done on a Tuesday, and I worked the rest of the week. And then when I actually had the bone marrow extraction, I wasn't sure what the next day was going to be like, but I could have gone to work. But I had already taken the time off, so I stayed home. But
that's a good thing.
I know, it was very nice. But actually, out of all 3 procedures, you can go back to work the next day. I did. I should have after, like I said, when they did the extraction and the injection. And downtime, you don't have downtime. The only thing is you wear your knee brace, like the doctor tells you, and it's fine. Yeah, I was doing stairs. I was still walking. I wasn't working out or doing anything extreme like that. But yeah, normal walking. Even after he did the marrow extraction on the second day, we were walking around Chicago afterwards. So as far I know, we were over at Millennium Park with everything shut down. We were feeding the pigeons until we had to come back that afternoon. But no, there was no downtime for me. I can't complain. And I thought there was going to be, and there was none, at least none for me.
That's great to hear.
And I got back to exercising and doing my normal routine. We're easing into it at the beginning of May. I had my procedure done this past March, and by May, I'm ready to go again. And I've already started, so.
That's awesome.
I'm so excited. You have no idea.
No, that's good. No, that's very good to hear. And then if I may ask you just the last question, please. What will you tell someone considering Chicago Arthritis for the Regenexx procedures?
Get to Chicago Arthritis. Don't waste your time. If this is your only option, do not do surgery before you go see Chicago Arthritis and Dr. Tambar and Jackie and all the staff there and Anthony. Do not let anybody cut into your knee before you go to this place and get your knee checked out. I highly recommend it. I just can't say enough about you guys as the staff and Dr. Tambar and everyone else that helped while we were doing the procedures those 3 days. Everybody is wonderful. They're all nice. All of you guys took care of me. I just can't say enough of you guys. Do not let anybody cut your knees open before you see Chicago Arthritis. Don't. This is a great place.
Yeah. Thank you so much, Ms. Rawlings, for that information.
Oh, you're welcome.
And we appreciate everything that you do for us as well.
Sure. Thank you.